Hey, hello everyone. How are you? I hope you are all healthy here. And let me introduce myself. My name is Dhia Aulia and I'm from the Faculty of Dentistry in Sultan Agung Islamic University, Semarang. Here, I will present to all of you, or I will socialize about how to prevent gingivitis. Hope you enjoy it. Okay, the first slide is about what is gingivitis, because we must know what is gingivitis. The definition of gingivitis. Gingivitis, or inflammation of the gums, is a condition that occurs due to poor oral hygiene or the accumulation of tartar. The infection will occur in the gums caused by the abundance of bacteria in the plaque and tartar. The condition will get worse and more serious if gingivitis is not treated properly, so it can develop into other disease. Many people often do not know they have this disease because the symptoms are not so obvious. However, gingivitis should not be left untreated. Actually, gingivitis is a common gum and mouth disease. This condition can be experienced by anyone, regardless of gender and anything. Gingivitis can be caused because someone who doesn't care with their oral hygiene. Untreated gingivitis can get worse because these gum problems can lead to periodontitis. What is periodontitis? Periodontitis is a serious gum infection that can damage the bone tissues that supports our teeth. Periodontitis can cause tooth loss and other serious problems. Okay, we move to the next slide. The next slide is about gingivitis signs and symptoms. Okay, first is the gums are red, swollen, and feel soft to the touch if we touch, and then gums shrinking, loose and shifting gums. The gums bleed easily when you brush or floss your teeth, and then any change in the color of the gums from fresh pink to the blackish red. Okay, like in the picture, is the gums is changed in color from fresh pink in the blackish red. And the bad breath that doesn't go away, or a bad taste in the mouth. And the last is intense and sharp pain when we opening the mouth to chew, bite, or even talk. Okay, when we experience these symptoms, when you guys experience these symptoms, we can immediately consult a dentist. We can move to the next slide. Okay, this is about how someone is gingivitis, or what is the cause of gingivitis. Gingivitis can caused by smoking habits, brush your teeth too vigorously, or lack vitamin intake, and rarely clean teeth, or we use a toothbrush that doesn't fit the contours of our mouth, or someone who has diabetes mellitus, or someone who wears dentures, or someone who has an abnormal hormone cycle, or maybe someone that use of sustaining drugs consumption of illegal drugs. And the main cause of this inflammation is the buildup of the plaque. The plaque itself is a sticky layer of bacteria that is form the deposition of food debris on the surface of the teeth. The plaque that is allowed to accumulate over a long period of the time will harder and form tartar below the gum line. Well, tartar is the triggers inflammation of the gums. Over time, your gums will swell and bleed easily. Dental caries can also occur if not treated promptly. Gingivitis can progress to periodontitis, which can cause your teeth fall out. Okay, and at the next slide. Okay, this is the mechanism of gingivitis. Gingivitis starts off by an inflammatory process being triggered by dental plaque. The bacteria and their toxins from the gingival sulcus penetrate through the intracellular gaps in the junctional epithelium to enter the underlying connective tissue. Okay, the stage or from the plaque formation to inflammation of the gums, the plaque is something that is sticky and invisible. Most are formed the bacteria mixed with food residue in your mouth. If they are not cleaned properly, the plaque will quickly form. The plaque can turn into tartar as it's sticky and hardens below the gums line and become tartar. This makes plaque more difficult to remove and then becomes a barrier for bacteria to irritate. So that is the reason why someone can get gingivitis. Okay, we can move to the next slide. Okay, the next slide is what are the efforts that we can be made. Okay, like my title is to prevent or to avoid gingivitis. So we can do many things to prevent gingivitis. First is brushing teeth 2 times a day. In mild case, gingivitis can usually be treated with more diligent brushing. We can brush our teeth at least twice a day, especially in morning and night, with proper brushing technique. Gently brush your teeth in a circular motion from top to bottom. Do the same for each section at least 20 seconds. All surface of the teeth must be brushed. Nothing should be missed so that there are no food residue attached. Finally, rinse your mouth by gargling with the clean water. And you also have to choose the right tool. Use a soft wrist brush with a small tip to reach the deepest parts of your mouth. And also make sure that the handle of your brush use is comfortable to hold. And for the toothpaste, we can use that contains fluoride because fluoride is effective for strengthening and protecting your teeth from decay. And second is we can flossing. To be really clean, don't forget to floss because flossing is a technique of cleaning teeth using floss to remove food debris stuck between the teeth and below the gum line. Okay, and then the third is quiet smoking, okay, or no smoking. Why? Because smoking is the biggest risk factor for gingivitis and gum disease. Therefore, from now on, you should try to stop smoking because this is the very, very important thing to preventing gingivitis. Quitting smoking can also improve your overall health, your mouth health, or your body health. And next is we can eat nutrition food. Why? Nutrition food is important to preventing gingivitis because proper nutrition can help your immune system more effectively to fight the bacteria that cause gingivitis. Avoid eating foods and drinks that have too much sugar. Why? Because the bacteria really like sugar. If we eat a lot of sugar, it can cause tooth decay. Okay, we can eat like fruits, vegetables, and other foods that contains vitamin, especially C and E. Next is avoid stress because stress can also affect the health of your teeth and mouth. When you are stressed, your immune system will have a harder time to fighting off the infection causing bacteria. So you will also be more susceptible to gingivitis and other gum disease. And the last is regular checkup with the dentist. Okay, it is very important because regular checkup in the dentist can make it easier for your doctor to monitor you overall your dental and oral health. Okay. And then this is for your knowledge, the efforts that can be made or the procedure that the dentist can do is scaling and root planning. Scaling is the procedure is carried out using a special tool called an ultrasonic scaler to clean plaque and tartar from the gum line. And second is root planning. Root planning, in contrast to scaling, this procedure is performed on patients who already have pockets affected by gum disease like periodontitis. Okay, and then what are the drugs that can be given to patient with gingivitis? First is pain medication. If the pain is so intense that it makes it difficult for you to chew and bite your food, your doctor can prescribe pain relievers such as ibuprofen and acetaminophen, or we call paracetamol. Second is mouthwash. Antiseptic mouthwash containing chlorhexidine can be used to help fight infection causing the bacteria in the mouth. Use your mouthwash directed by your doctor. And the last is antibiotics. Your doctor may also prescribe antibiotics to prevent the infection from getting worse. Antibiotics work by suppressing the growth of bacteria that cause the infection. But we must pay attention to the doses and how to use it to avoid worsening gum condition by your doctor. Okay. Okay, the next slide is about consequence improper dental health care. Gingivitis that is not treated properly can also cause the disease to be incomplete and occur repeatedly. Treatment of this condition is usually done by giving antibiotics and cleaning the plaque known as scaling. Treatment must be done immediately because left untreated gingivitis can spread and affect the health of tissues, the teeth, and even bones. Okay, there's the conclusion. The conclusion is the main cause of gingivitis is poor oral hygiene that cause oral health, especially in the area of the gums to become disturbed or inflamed. So that the thing that can be done to prevent gingivitis is to always maintain health teeth and mouth from bacteria. Okay, this is my search is from the journal. Okay, thank you very much for your attention. I hope you will always stay healthy and you always can protect your oral health. Okay, thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.